name is Arjuna Manamperi. We will start the session now. I'm the National Issues Committee Chairman of the OPA. Before we go through this process, I will inform you what the agenda for the day is. But before that, I invite our President, Engineer Shantha Senrath, to give a few introductory statements. Mr. President, your turn.
Engineer Arjuna Manamperi, and the Chairman of the Education and Human Resource Development Committee, and the moderator, one of the moderators today, Professor Indika Karunatilaka, and Professor Manoj Veerasinghe, the other moderator. Ladies and gentlemen, a very warm welcome to all of you. It gives me immense pleasure to participate in this very timely seminar organized by the National Issues Committee of the OPA, Organization of Professional Associations, in collaboration with the Education and Human Resource Development Committee. Both are two very dynamic standing committees of the OPA. OPA is the apex body of 52 professional associations representing 32 professions. Out of all the standing committees, National Issues Committee is in the forefront always whenever there is a nationally important matter to be deliberated. Our country and the people are going through immense difficulties at the moment due to the COVID pandemic, and world scenario in general is much worse. COVID deaths are on the increase on daily basis, and the hospitals have begun to overflow with COVID patients. The economies have crashed in many countries, and it is obvious that Sri Lanka is also heading towards a very difficult period, and its short-term and long-term effects to the human lives. In this regard, this webinar will provide you all with a host of information, because the presenter today is a world-renowned virologist, a Sri Lankan living in Hong Kong, Professor Malik Pieris. Professor Malik Pieris has brought a lot of honor to Sri Lanka through his research work, and it is a widely known fact that he was the first to discover the SARS virus, severe acute respiratory syndrome virus, a virus similar to the COVID-19. Dear Professor Malik, I thank you immensely for accepting and participating in this OPA program as our guest lecturer, and we look forward to listen to your presentation to understand more about COVID-19, and also whether we can think of a COVID-free country in the near future. Also, I take this opportunity to invite you to the OPA to educate us more on this subject when the situation is conducive to have a physical conference. Thank you.
Ladies and gentlemen, we have an expert presenter today. He has made an outstanding contribution at global and national level towards the control of the pandemic. He is none other than Professor Malik Pieris. He is most notable for being the first person to isolate SARS virus. He is a world-renowned virologist and a scientist based in Hong Kong. He is here on a vacation, and thank you very much, Professor Malik, for being part of this event. He has led groundbreaking research with a particular interest in newly emerging viruses such as coronaviruses. Professor Pieris has published more than 600 scientific papers in a research career spanning more than 35 years. He is the chair, professor of microbiology at the University of Hong Kong, honorary consultant microbiologist at the Queen Mary Hospital, and the scientific director of the Hong Kong University Pasteur Research Center in Hong Kong. The session will be moderated by two professionals who have been in the forefront of the nation's battle against COVID-19. There are two doctors and eminent people, and if you watch the national TV, you will see
for that introduction and the opening remarks. And today we are going to have a historic meeting related to COVID-19, and it's because more historic because we are going through a crucial moment in our motherland related to the current crisis situation. And there's no one better than Professor Malik Pieris to discuss the current situation and tell us the way forward. And also it becomes very important because the meeting is several professionals, all the leading professionals in the country, into one forum and to discuss what's the current situation and what should be the way forward. And then this should be a very important meeting where we can make important decisions and recommendations that could determine and maybe to show the way forward how we can get out from this crisis and move forward. And this session will be started with the opening remarks and a brief presentation by Professor Malik Pieris providing the current overview. And following that brief presentation, we'll be moving into a question and answer session where I will be discussing the areas that are relevant to. Then followed by questions from the audience. You can send your questions through chat, and then we'll be forwarding the questions to the resource person. And I can see a lot of prominent resource persons and medical experts in the field in this forum. So we should be able to provide opportunity for them also to select a part of this discussion. Without further ado, I'd like to open the forum for Professor Malik Pieris for his opening presentation. Over to you, Professor Pieris.
Thank you very much, Indika. And it's a particular pleasure to be to join this particular forum because, as was pointed out, it's an organization of many professional associations. And as was pointed out, a problem of this magnitude really requires multiple professional input. So in discussion with Indika, I'm going to keep my remarks fairly short so that we have more time for discussion. Right, so I will do a very quick update on the global, but mainly the Sri Lanka situation. But again, my colleagues Indika and Manoj are probably better informed about the local situation. Right, so some of the slides I will be using, I have to acknowledge the WHO country office in Colombo, and also my colleague, Professor Gabriel Long, who used some of these slides for his presentation last week at the WHO R&D Summit. So this slide just shows the global situation with COVID-19. And as you can see that by February, things were looking quite good. The overall case numbers were coming down, but unfortunately, you can see now from March, April, the global case numbers are going up. But the more concerning thing for us here in Sri Lanka is that the numbers that are going up are because of this purple colored part of the bar, and that is Southeast Asia, exactly where we are. So essentially what we're having now is a major outbreak, a series of outbreaks in India, in Nepal, in Bangladesh, in Sri Lanka, but also in Malaysia, Thailand. So this whole region has become a hotspot, sadly. Now, I'm sure you have seen the very distressing images that we see on the TV screens from India. So what exactly happened? What you can see at this top chart, I hope you can see that well, but essentially you can see the case numbers suddenly increasing over the last few months in India. Now, on this lower chart here, what you see is what is called the Stringency Index. That means the stringency of public health and social distancing measures. So you can see that the social distancing measures were dramatically reduced and things were quite relaxed for quite a period of time before the lead up to this particular upswing. Now, of course, the vaccination program has started in India, but as you can see, it is still only about 7% of the population have even received a single dose, which is not very different to Sri Lanka. So the causes for this major upswing in India, partly, importantly, is the relaxation of the public health and social measures since October of last year, the low vaccination coverage, of course, and importantly, also the emergence of a more transmissible variant, and we'll discuss this. I'm sure you have heard about the so-called double mutant. Now, what you see here is the impact of this double mutant. This is globally across India. And you can see this green part of this chart. That is this new variant virus called B117, the so-called double mutant that was first described in India. All these other ones, all the other colors are other variants. So you can see very rapidly, once this particular variant has emerged, it has squeezed out all these other viruses. And this is a classical signal suggesting that this virus is more transmissible than all the other viruses that are circulating. And also among them is this purple one here, which is B117, which is the UK variant that is currently circulating in Sri Lanka. So this, the double mutant that is in India seems to be much more efficient than everything, including the variant that is present in Sri Lanka. Now, I was particularly concerned when I first heard about this some months ago, because there was an upswing of cases, even in places such as Maharashtra, which is where, for example, Mumbai is, because I knew that by the end of last year, what are called seroprevalence studies, that is looking at antibody in the population on a population basis, showed that in that region of Maharashtra, about half of the population had been already infected in the first wave in that Indian outbreak. So the fact that there was a second wave that was sweeping through a population, which half of the population should already have immunity, was very concerning to me, and it remains very concerning to me. So the question is this new variant able to evade, at least partially, pre-existing immunity by natural infection and also by vaccination? Now, what is the situation in Sri Lanka? I'm sure you're familiar with this, the pattern here. We had a first wave, if you like, then we had this second big outbreak starting with the Minuanguda cluster and then going on. And then, of course, just in mid-April, you have this huge increase of case numbers. And then, sadly, of course, inevitably, you have this black line, which indicates deaths. So keep in mind the scales for the blue chart and the black chart are different. So this is the scales of the deaths here. And you can also note that inevitably, the deaths lag the cases by a period, by at least 10 days or 2 weeks, right? So the impact on mortality of this huge increase of cases, we still have not felt. That will be felt in the next couple of weeks. So if you just look at the case increase, now this is data from the WHO office in Colombo. So if you look at 3 weeks previously, there was a huge increase, and then week on week, there has been an increase of cases. There appears to be a moderation in the rate of increase, but again, we can discuss that, how reliable that may be because of a number of factors of testing. But then again, we have the deaths increasing on a week-by-week basis, continuing to increase. So we do have quite a worrisome situation on our hands. And again, if you look at the reasons for this, again, there was relaxation of public health measures, particularly, of course, over the Sinhalese New Year period, when there was a lot of people moving around, a lot of shopping, a lot of travel across. So that gave the virus a huge boost. But then, unfortunately, exactly at that time, very early in April, as was reported by Professor Malavige and colleagues at Sri Jawadarapura, a new variant was detected, this B117. This is the variant that was first detected in the UK. And then, of course, combined with that, we still have low vaccine coverage. So the same three factors that are present in India, unfortunately, are present here and contributing to this big outbreak that we have. Now, before I go on, I just want to re-emphasize that the transmission of the virus is not really changed in the modes of transmission. It is much more transmissible, as I will point out, compared to previous viruses. But the modes of transmission, the mechanisms of transmission essentially are the same. It is just that the virus is able to transmit more efficiently. So the modes of transmission is when somebody breathes or coughs, you have these large droplets which may fall to the ground within a meter or two. But then there are these very fine airborne particles that remain suspended in the air. Now, there's been a lot of controversy and a lot of excitement about this airborne spread. But indeed, from last year, we have been essentially saying that COVID is spread by both these routes, large droplets as well as airborne particles. What is important, of course, is that although the fact that you have infectious particles floating in the air can mean under certain conditions that you can have transmission over quite long distances, the distance to the source is an important factor in terms of concentration of dose. So that the closer you are, the higher the dose of these airborne particles you're going to get. So what it means is that distance is a protective factor. Ventilation is a protective factor because these will reduce the dose that you will get exposed to. And one virus particle will not infect a person. You really need to have a minimum dose to initiate infection. We also know that masks reduce the spread of virus from infected person and also reduce the inhalation of these infectious particles. And we know that this infectious material can contaminate surfaces. So if you may touch these contaminated surfaces, and that's why hand hygiene is important. So as I said, these are the same routes of transmission. It's just that this new variant is much more transmissible through all those routes and also through other mechanisms because the period of infectiousness of an individual seems to be longer. Right. So when we look at transmission of any epidemic, there are a number of factors. You have the virus itself. So about the virus right now, what is most concerning are these new variants. You have the public health and social measures which control contact between individuals because the virus, in order to spread, really you have to have person-to-person contact. Then, of course, you have environmental factors. You have immunity in the population. Now, sadly, at the moment, of course, because the only way you can get immunity is either by natural infection, which we don't want to get anyway, or by vaccination, which we are trying to get. So let us consider each of these in turn. Firstly, the question of the virus factor, and in particular, the viral variant. So this is a schematic of the SARS coronavirus 2. You have these proteins sticking out of the surface of the virus, which attaches to the host cell. As with any virus, it has to replicate inside living cells, in this case, in human cells. And when the virus replicates, being an RNA virus, it continues to make occasional mistakes. And these are mutations. Now, most of these mutations are bad for the virus. Essentially, the virus does not survive. So we don't even see it. Quite a number of these other mutations have no real effect, either positive or negative for the virus. So they are of no biological significance, but they can be used to track the virus. In other words, who gave the virus to whom. But a few of these mutations confer advantage to the virus. Now, this is just a random process of trial and error from the virus's point of view. And those rare mutations that give an advantage, of course, will get selected and will gradually become dominant. Now, it's important to remember that from the virus's point of view, there is no real advantage to the virus for increased disease virulence or severity. The virus is only concerned about transmission, right? Essentially to propagate its genome. Now, if you then look at how the virus has diversified from the time of its first emergence in Wuhan, and this is a very simple schematic, basically something like a family tree. So you have your father, your great-grandfather, grandmother, great-great-grandmother, etc. So this is a family tree. You go back to Wuhan or wherever it started back last year, and over the time, it has diversified into different lineages, if you like, families or whatever it is. And along the way, one of the important mutations that took place very early last year, around February. Now, again, I'm not sure whether you can see this particular chart because it may be hidden, but this is this mutation called G614G. And very rapidly, because again, it's a mutation in this protein that the virus uses to bind to the cell, it improved the binding of the virus to the cell so that within a matter of months, the global population of virus became dominated by this mutant virus. Now, luckily, it didn't get to Sri Lanka immediately, but the Minuwangoda cluster essentially was the first introduction of that variant virus into Sri Lanka. And as we know, that led to a major increase in cases, Minuwangoda, the Paliagoda outbreak, and then the virus did change its behavior, as we all know. Then, of course, the next major significant change of the virus was first detected in the UK, and this is this B117 virus. Again, a number of mutations, particularly again in this spike protein, which allows the virus to transmit more efficiently. So this was first detected in this part of the United Kingdom in October, but you can see that within 3 months, it had spread to dominate the whole of the United Kingdom. As I said, it has a number of mutations, but in combination, it makes the virus at least 50 to 70% more transmissible than previous viruses. It possibly does have a slight impact on increasing severity. Now, the good news, if there is any, is that this particular virus does not escape from antibody immunity. That is either from past infection immunity or from vaccine immunity. So the vaccine will effectively stop this virus. It also has one of its mutations results in a signal in one of the particular PCRs, and that is what is called this S gene target drop, which was how the virus was first detected by Professor Malavige back in early April, and then confirmed by sequencing. But there are a number of viruses of concern, but the other virus, of course, that is close to us is this B1617, which is the so-called double mutant that was first detected in India, initially detected in October, but rapidly increased across India, but particularly, as I said, in places like Maharashtra, in spite of population immunity. It has got multiple mutations again, and some of these mutations have been found individually in other viruses in the USA, in South Africa. And these mutations individually, we know, are undesirable. They increase transmission and also potentially allow the virus to partially escape immunity, past immunity, and potentially vaccine immunity. So this was really, as I showed you, the virus that is dominating the outbreak in India, and it has now spread out of India. It is now causing concern in the UK, and where it is possibly spreading faster than the existing virus, the UK variant B117. There, you might have heard of outbreaks in Singapore, including at Changi Airport, also caused by this same virus. And the big concern, as I said, is the concern that this may have the capacity to partially, at least, evade the immunity that is elicited by vaccination. So in other words, of course, it is unlikely that it will completely escape vaccine immunity, but we really don't want anything to reduce the efficacy of the vaccine. And that is exactly the reason why we should do our very best to prevent this particular virus getting into Sri Lanka. And in that situation, it is extremely disappointing, I must say scandalous, that there have been people who have been trying to entice tourists from India into a pseudo quarantine type of setup. I mean, of course, anybody can come in to any country, including Sri Lanka, but as long as you go through the proper quarantine procedures. But if you evade quarantine, if you have contact with other people without very strict measures, that is a recipe for disaster. And I really hope that We haven't, well, we know that already Professor Malik has reported 2 instances of detecting of this virus, but we don't know whether it is spreading out in the community. If it is, it will be extremely bad news. And in this context, before I leave this, I just want to point out, and this is important because this is a multidisciplinary forum and we are hoping to have a good discussion later. I mean, we completely understand that the economic aspects are important. In that regard, tourism is important. Some of my closest friends work in the tourist industry, and I know how badly the different aspects of people working in that industry have been affected. Now, you can try to bring back tourism. Of course, not at this stage, not right now. Nobody's going to want to come to Sri Lanka now. As you know, Sri Lanka is on the red list of a number of countries. But if you go back some months when the situation was a bit more calm, one could have targeted countries where the outbreak was under control. For example, the classic case would be China. I mean, that would be a great place to attract tourists to Sri Lanka from in the past. Unfortunately, what happened was we tried to attract tourists from the worst places. And of course, most recently, as I tell you, from India. So this is just to emphasize that we are not forgetting about the economy, but we have to be smart about how we protect and how we support the economy. Right, so come back to this same chart. We talked about the virus now. I will briefly talk about the immunity, the vaccine immunity, and then talk about public health and social measures. Now, we have vaccination, and vaccination is being rolled out. As of now, large parts of the country have not had access to vaccine, except for healthcare workers. So the vaccine rollout has been primarily focused on 1 or 2 provinces. The vaccine has not been targeted at the highest risk groups, which are the elderly and those with comorbidities. Of course, rightly, the vaccine was targeted at healthcare workers, which are fundamentally important. They're a high-risk group. But next to that, in most countries, UK, USA, Israel, Hong Kong, wherever, the vaccine rollout has been systematic from the oldest population downwards. And if even this 6% of vaccine had been targeted to the high-risk groups in Sri Lanka, the elderly and those with comorbidities, at least part of them, we probably would have been, we would have, at least in terms of protecting from mortality and ICU admissions. Now, the vaccine supply remains a constraint. Now, this, of course, is a global problem, without a doubt. And I mean, I commend the government for doing its very best to try to secure vaccine. Now, there is a delay between starting vaccine and the vaccine having an effect. So you need 2 doses, particularly of some of the vaccines available in Hong Kong now. You need the 2nd dose, and it's about 2 weeks after the 2nd dose that you have maximal impact. With AstraZeneca, you do have some protective effect from a single dose. So the vaccine is clearly a part of the long-term solution, but it's not likely to impact the current problem that we face, which is hospitals being overloaded, the healthcare workers being exhausted. So the question is, how do we get there, a vaccinated population from here where we are? And we have a threats from a number of variants. And it's not just the variant from India. There's also a variant in South Africa and a variant in Brazil, which are evading partially the protection from vaccines. Right. So let me now talk about the public health and social measures, which is what we have on hand to contain the challenge that the country faces right now. Now, you have seen some of the interventions that have been put into place. For example, limiting travel between provinces. But if you just look at the data, if you just look at the cases during the last seven days, you can see that now cases are present in every province in the country. If you look at the increase compared to the previous week, you can see that in most provinces, there is dramatic increase. So stopping people moving from one province to another is not really going to reduce transmission at this stage. Maybe if it had been introduced back in the middle of April, it might have had an impact, but not now. Then, of course, there is the talk of lockdowns. Now, how do lockdowns work? Now, this chart shows the propagation of an epidemic. So you have one infected person, he or she meets 2 or 3 other people. It may transmit to one person or 2, and then onwards and onwards. Now, what is achieved with a lockdown is that you compartmentalize these people into households, in theory, right? So let us say this person is infected. Within that household, there would be maybe very likely transmission to 2 or 3 other people in the household, whoever is there. Hopefully, most of them will be mild and asymptomatic. If somebody is seriously ill, that person will be taken for care in hospital. But as long as it is confined to one household, the virus has no chance of spreading further. And once the virus runs out of people to infect, it burns out, it dies, because it cannot survive hanging around in thin air for days and days. So how long does this lockdown have to be? Overnight, keeping people at home? Obviously not, right? So there is a science to this. And the science is based on the period of infectiousness of an individual. So let us say this person was infectious at the beginning of a lockdown period. Now we know that the period of infectiousness of an individual is 5 to 7 days. So if this person is infectious at the beginning of a 3-day lockdown, he will remain infectious at the end of the 3-day lockdown. He'll be out in the community on the 4th day and the 5th day, right? Then there's another issue. That's the incubation period, meaning from the time you get infected to the time you develop symptoms and become infectious. And that the median is about 5 days. So let us imagine this person in the household was infected. There is a lockdown. He may transmit to other members. And this interval on average would be around 5 days. So these people might get infected. Now they have to now become non-infectious, which means 5 days plus another 5 to 7 days, 12, 13, 14 days. So this is why 3-day lockdowns are going to have minimal effect. So I would end here and I just summarize the situation. And my colleagues, Indika and Manoj, can have much better first-hand experience. But from everything I hear, the health system is at a breaking point in terms of the clinical staff, nursing staff, the public health staff, the PHIs who are doing a fantastic job, the laboratory staff who are working under tremendous constraints. Everybody is exhausted and at breaking point, probably beyond breaking point. So we, I think, are at a tipping point in this whole situation. So I'm sure some of you, those of you in mathematics, in engineering and whatnot, fully understand this concept of a tipping point when beyond a certain point, things go out of control, then the problems don't increase in a linear fashion. They just spiral completely out of control. So we are in urgent need of a circuit breaker to rapidly reduce transmission, contain transmission, so that the health system can take its breath, literally speaking. Then, of course, we have the question of how do we balance the control of this pandemic with maintaining the economy. And this is definitely something that we should discuss, and I hope we can discuss it during the Q&A session. And finally, I just want to highlight the dangers, the twin dangers of complacency and exceptionalism. And I think exceptionalism is what the United States suffered from in the early part of last year when it thought that it had systems that was good enough to deal with this virus. And indeed, India probably thought the same thing, that it will never affect us. So I really hope that Sri Lanka does not also think that we are exceptional and that this virus cannot go out of control in Sri Lanka. So with that I will end, and I really look forward to the discussion together with my colleagues, Indika and Manoj. Thank you.
Thank you, Professor Pieris. I actually cannot think of a more comprehensive account regarding the current situation, covering all the necessary areas, including the virology, epidemiology, the vaccination, and the economic aspect, and the possible issues that we are facing. However, the most important thing that you have mentioned was that we have reached the tipping point and the breaking point. So that may be something that we need to discuss in further. And you have very correctly mentioned that the patient numbers are increasing. What I want to ask is, now we see when you look at the epidemiology curve, we see the patient numbers are almost say the same, like 2,500 per day or 2,400 per day. Last 4 days, it has remained the same. What do you think? Is it the real picture? If not, what could be the current situation? And maybe
if there are more cases, even if there is more demand, it doesn't have the capacity to increase. So in that situation, you will basically have flat numbers of cases limited by testing capacity until such time as the percentage positivity goes up. Now, for the percentage positivity to go up, that is a greatly lagging indicator. That would happen only when the situation is much, much worse. So I have my doubts as to whether the plateauing that we are seeing now is a genuine plateauing of the outbreak or not. And I don't think for public health control, given the situation that the healthcare system is at this moment, we can take a risk on that, making an assumption on that. Over, but I'm sure Manoj can comment on this.
Manoj, would you like to comment further, say what could be the actual number and maybe the possible projections? Professor Manoj Pieris, or to you?
Thank you, sir, for the elaboration, the description. Yes, the question which was asked, my observation is due to our limited capacity of testing, we need to understand what we test per day is around 20,000 in average, and that we test on a sample of people of this country, majority who are contacts and others are possible patients who are coming to the hospitals and so on. So because of the ceiling effect coming, my personal observation is when we have increased bit of the positivity rate from about 6 point to up to about 6% to about 9%, and it's possible it could go up. But I personally feel what the actual numbers in the ground based on the current numbers is much higher, because the incidence of cases for me from my own observations should be at least twice or maybe close to 3 times of what we find from PCR test at the moment, which means that at least about 3,000 cases are undetected and are going around in the community. That is why, as Professor Pieris very clearly stated, that what we see at the moment is what we find, but the actual situation is very likely to be somewhat exponential increase of cases. That is somewhat supporting our observation is the deaths. If the number of cases are flattening, then it's unlikely the number of deaths could increase in a more rapid way. What we see now is basically what the infections that I had about 10 to 2 weeks ago. So if you look at late May or early June, we will see the transmission of diseases at this particular moment, and which means that the deaths would follow, as Professor Malik very clearly showed in that graph. The deaths would be further 2 weeks away. So the actual transmission dynamics in the field at now and the deaths which could be contributed for actual field dynamics now, we will see only somewhere in mid-June. So that is the issue I think we are facing at the moment.
Thank you, Manoj. Now, you mentioned about the number of cases and the actual number. The possible number is much more than probably maybe 2 times or 3 times. Now, the testing capacity, which was correctly mentioned by Professor Malik Pieris. Now, Professor Pieris, what do you think? What about Sri Lanka's testing capacity? Now, at the moment, about 25,000, 26,000 tests are done per day. But again, there are long delays happening. So do you think that it's possible to increase the testing capacity? And I'd like to have Manoj's input also. Is there another way to address this issue? Prof. Malik, over to you, and then Manoj.
Yes, I think given the current laboratory setup, I mean, I think the PCR testing is already running at capacity. I know the lab staff are completely overwhelmed at the moment. Now, whether we can bring on private sector, etc., on board, I don't know the local ground situation that well. But we also have the rapid antigen testing, which can be used. Now, as we know, the rapid antigen test is maybe a bit less sensitive overall, but it is quite good at detecting people who are highly infectious. So people who are highly infectious have very high concentrations of virus in their respiratory tract, and the antigen test is quite efficient at detecting those. And those are the people that we need to detect, primarily from the point of view of isolation and preventing transmission. So for hospital diagnosis, still PCR is the optimal method, but for epidemiology, contact tracing, and control, the antigen test could be quite a good alternative. So I think combining these and deploying them in an intelligent fashion, we can get improved capacity. But again, I think Manoj can comment on that.
Yes, sir. Just to add just couple of things.
Manoj, what you...
Yeah, if I can add a few things to Professor Malik, we need to understand as a country, there is a limit that we could expand our public sector and even the private sector on the testing capacity of PCR. So I think at this particular moment, if we are looking forward to increase this testing capacity in large numbers, I think it's not realistic. In order to face the current issue, I think the best method is to use the available resources more efficiently and to look at how are we going to use this number of tests to get the maximum out of that, and to whom to be tested, when to be tested, and to use two mixers, the antigen plus the PCR, in the most efficient way. So I think that is where we stand now. And I personally don't think we have much capacity in the near future to increase. And in addition to what Professor Pieris said, yes, in Sri Lanka at the moment, at least 1/4 to 1/5, 1/3 of the tests that are done at the moment, it involves private sector. So we are already involving private sector, but they also have a huge capacity limitation. So we need to think about that also at the moment. So as Sir said very clearly, we may have to look at our testing strategy again and again based on the field dynamics.
Yeah, so
Sir,
I think just to extend on that, I mean, I think we can use our testing capacity more intelligently than we are doing now. I mean, given the fact that there is a limitation, I think we need to more strategically target what we are doing. Over.
Sir, can I just pose a question to you from some of the chats which has coming? Sir, what are the other methods that we can use? Not expensive, but there are LAMP assays coming in and so on, just to give a very general understanding to there are medical people and others. What other options do we have in this moment?
No, the LAMP test is certainly
so we
an option.
cannot hear you.
Sorry, can you hear me now?
It's clear, we can hear.
All right, okay. So the LAMP test is another nucleic acid detection technology which is quite feasible to use, and it has a number of advantages. And I've seen, I think some of the local scientists have developed such an assay. So it certainly can be deployed as well. So I think these, of course, they have to be validated, and monitored for their performance, but in theory, it is being used in a number of other places as well. Over.
Thank you, Prof. Manu
Hello.
and Prof. Malik, and
Can you hear them?
highlighted the need. You have both of you have highlighted the need for the rational testing, and a rational testing strategy probably maybe based on the public health expertise. I can see a lot of experts related to testing and several virologists also within this audience, so their inputs also would be very valuable. Yeah, so we'll move into another very important area. Professor Malik Pieris very correctly mentioned that we are at the tipping point at the moment, and the 3-day lockdowns, due to several reasons, including the incubation period, the 3-day lockdowns will not work. So let's get back to the most crucial question. In this critical moment, what do you think? What should be the urgent measure that we should implement right now without delay? Over to you, Prof. Malik.
Thank you. So I think for the reasons that I explained to you, which are basically scientific infectious disease virology-based factors, it's not something that I'm just picking out of thin air. I think a minimum of a 14-day lockdown is what is required at this stage. I mean, we might have been able to get away with some of these other less stringent interventions some weeks ago. But at this stage, when we are really at tipping point, I think we do need a 14-day intervention, very strict and solid intervention, which can be signaled very well in advance so that people can prepare, the traders can prepare, the individuals can stock up whatever needs to be stocked up. It's very well signaled, but then it has to be 14 continuous days. Now, people might think that, why not do 3-day, 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 5-day, etc., spread out. But again, I explained the reason why that is much less effective, because you are not burning out the chains of transmission. So one continuous intervention is much exponentially more impactful than multiple short interventions. And this is where I think our audience, our multidisciplinary audience, can also provide us with some input. Now, is it really the case that for businesses that these ad hoc 3-day here, 2-day there, another 5-day here interventions are less disruptive of their business operations? Does it really have such a big impact on the daily wage earner? As from what I can see, the number of daily wage earners are not getting work now because the situation is out of control and people do not want to hire people who normally would have work. So I think we really have to be realistic as to the damage that is already being done because of the pandemic and balance that with the opportunity to try to bring this under control and then get back to something a bit more predictable. But I think, Indika, you know better than me the state of the health system and whether the health system can tolerate, sustain any further caseloads. Over.
Thank you, Professor Malik. So the message is loud and clear that if you have to break the chain of transmission at this crucial moment, then we need a very clear lockdown, not 2 days, 3 days, at least 2 incubation periods. So that's the message that is loud and clear. Prof. Manoj, would you like to add anything into that?
Yeah, 2 or 3 points, basically adding to what Professor Pieris said. This is a period of uncertainty. And the period of uncertainty, are we going to have a long period of uncertainty, or are we going to be very clear and specific, stating, right, at this stage, at least from 21st of this month, we are going straight forward, stringent restriction measures for 2 weeks and see how it works? Or are we going to extend this period of uncertainty where even the investors will be not really clear how are they going to plan their further actions. And the other people who are the daily earners and others, they also in a very uncertain period where they do not know when they will have a time to get to their normal life. So as there are many investors, there are many professionals in our audience, that is a place for us to think. Are we going to have an indefinite uncertainty period, or are we going to do it, crush this immediately, get a stock after about 14 days and slowly release the restrictions? I think this is the way that from the health side we think, but we need other intellectuals and others in other disciplines to come and show us how to get it around without unnecessarily burdening the economy. Thank you.
Thank you, Manoj. So again, the message is very clear. I think this forum, that's why this forum becomes very important, because now we know the reality. The reality is that there is something that we have to do straightforward without delaying. And this would be an important opportunity to find out what the other professionals think about this situation, because ultimately what's most important is the crisis situation where the health system is at the breaking point. We have to break the chain of transmission. Yes, I think there is a Dr. Jude Jayamaha want to make a brief comment regarding the testing capacity, because we were discussing that also. Jude, for a brief comment, please. Dr. Jude, you can unmute your microphone.
Jude, are you there?
Yes, I'm there. Hello. Yeah,
Yeah,
thank you
sure.
for unmuting the microphone. Yeah, good evening. I'm Jude Jayamaha, virologist from MRI. Myself and Professor are with the virus since the last year, 5th of January. So MRI has actually, we have a long experience and in-depth experience. 300,000 PCR has actually concluded. Very briefly, 3 points I just want to highlight. Now, of course, the pooling is not possible. And of course, sir, a lot of repeats are there. And we do have cycle threshold 32,
Hello?
33. Hello, can you hear me? Sorry.
Oh,
Hello.
Yeah, we can hear you.
Yeah, we can hear you.
I'm sorry. Yeah. So there are actually certain ground realities, of course, apart from the really exhausted. The now sample receiving, of course, is very high, and especially central laboratories like us, Kandy and Karapitiya, we do get from lot of sites. So therefore, we have a big problem since the day one also. The samples that we are receiving is not in good in the sense order. To sorting out, it takes time, because now LAMP is actually been discussed in several forums, and there actually is a misinformation that has been inhibited, and we are not actually allowing the local the manufacturers, which is not. LAMP, for the benefit of the other professionals as well, it is the last step. PCR is a 6-step step. There's multiple steps, because we need to take sort out the sample. This is a high risk sample, which of course in most laboratories a group of people actually open the high risk box. So very briefly, it's actually multiple steps, especially at MRI. It's happening in almost 5 rooms. So it takes time, and of course, especially before this third wave, as well as in the initial wave, we can actually do within a given 18 hours something like 2,000, 2,500. But this very high positive rates, it's not possible to gear up because of the high positive rate, as well as samples are coming from different part, and the batches are very high. And of course, as you quite correctly mentioned, I really should appreciate that whatever the limited time, because of the politics as well as other because of lack of knowledge what is actually a PCR, a lot of people just scream that the test number has to be increased. True enough, no argument, no doubt, it has to be increased, but it has to be in a realistic fashion. Because now, for instance, time to time our PCR machines are actually breaking, and our biosafety cabinets are breaking. Actually, few MLTs
Sorry,
as
sorry,
well as
Jude.
supporting.
Can I just Indika, as I said, I'm sorry, I have another telecon which I have to
Yes, sir.
join. So please continue. I mean, I think it is excellent. There are many
Yes,
highly
sir.
competent people on the call, so please do continue. But my sincere apologies, because I do have another call I have to attend to. Okay, so please continue.
Can I just ask one question in the forum that it would be really good for you to answer? People are asking from the forum, why can't we accelerate the vaccination program now rather than having a lockdown? Can you please answer before you leave?
Yes, so first and foremost, vaccine is in short supply. Secondly, as I explained, it takes quite a number of weeks before the vaccine will have any impact. Now, we don't have quite a number of weeks at the moment. I mean, as I said, we are already at overcapacity. Even in theory, if we had unlimited vaccine, it takes time to deliver it. It takes time for the body to mount an antibody response to it. Ideally, you need a second dose, which is given at least 1 month after the first dose, and particularly important for vaccines like Sinopharm. So vaccination is critically important, no doubt, for the medium term, but it will not solve the problem that we are facing immediately. So with that, thank you very much. And I apologize, but please do continue your discussion, which is excellent.
Prof. Malik, thank you very much for your excellent contribution, which is invaluable. Jude, would you like to conclude your CV very briefly, if you can conclude, and then Manush can respond as well?
Jude, are you still with us?
Yes, can you hear me?
Yeah, sure.
Yeah, if you can very briefly conclude.
Yeah, very briefly. Yeah, very briefly in the sense, whatever the test number is actually very limited within very few days. So that has to be quite correctly, intelligently used. Now, again, within 30 seconds, now, for instance, there's a tendency where if there's a positive particular area, 600 to 1,000 samples are coming from that particular area, as quite correctly Manoj mentioned. So if we can find another location, for instance, Kuliapiti, we have already tested nearly 4,000. Whatever the resources, including the PCR, is very limited. So other thing is, especially the rapid brief, but if it can...
Jude, you are breaking.
The connection may be breaking.
I think there's a connection problem. Can I just add few things where Professor Malik actually concluded?
Please do.
Yes, because there is a huge question that is being posed every time when we have something like this, that why vaccination program cannot be accelerated and so on. I think Professor Malik gave the basic answer where vaccine is short supply. So whatever the countries across the world, except for few developed countries, are struggling at the moment. So that is one. Second one is that there is some misconception and also orchestrated by some people from the media that vaccine gives you immediate protection, which Professor Malik also elaborated on. Particularly, we know that we had 3 vaccines already coming to country. AstraZeneca, which we have a problem now because of a short supply, it gives some protection even from the first dose. And the Sputnik, from the data that we have seen, it also gives some protection from the single dose after about 2 weeks. But if you look at Sinopharm vaccine and its general data that we seen, it takes quite some time to get any protection from the vaccination. Particularly, you need to have the second dose after 4 weeks, and still you need at least 2 more weeks to get some protection from Sinopharm. So the basic answer is vaccination at this moment is not an answer for the lockdown that we are asking, whether you want to call it a lockdown or severe restricted movements, because the purpose here is to reduce the transmission in the community as quickly as possible, and vaccine will not be an answer at the moment to that. So that is the basic thing I think I need to tell. The other thing actually the Jude was talking about, that they are getting samples from all over the country, and our capacity is limited. And as I told you earlier also, we can ask for huge numbers to be tested, but we need to understand our resource levels are very low as a country, and there's no point of just trying to increase the numbers. Then we have problems of human resources and so on. So I think the best way out, as we have discussed many times now, to relook at our strategy of sampling and testing, that would give us the optimal balance to get the most out of it from the samples that we have or the test sites that we have at the moment. Thank you, Indigo.
Thank you, Manoj, and thank you, Jude. Very important message, because there is a lot of pressure to increase the number of testing, but it is very clearly, it was shown very clearly, loud and clear, that just by increasing the numbers, we can't solve this problem. It might even overload the current system and might lead to further chaos with the testing result delays, so on and so forth. So the need is to move towards a rational testing strategy and not just increasing the testing number, because testing capacity is not only the numbers. So again, the message is very loud and very clear. Okay, let's move into another area. Now there are some questions coming up that if you move towards an immediate lockdown for at least 2 incubation periods, what about the people who are economically deprived, the daily wage owners, so on and so forth? And again, worldwide research has shown that it is the economically deprived and the underprivileged who are basically affected during an epidemic and a pandemic. So what do you think? Now this question was coming from Mr. Dulitha Perera, who is the president-elect of OPA. What about those underprivileged populations? What will happen to them during a lockdown? What could be done? What are the practical suggestions? Prof. Manoj, you can answer, and maybe if there are other suggestions from other professions, that also would be very welcome.
It's a very difficult question for a person from a health side to answer, because we are looking from the health side. Yes, this is an issue that has been raised throughout from the first lockdown that we started somewhere in 19th of March last year. And what we have seen basically is what is the cost of having a long or a protracted epidemic versus a short restricted movement that is imposed, and to trying to crush the epidemic as quickly as possible. I think there are positives and negatives both. If you look at, as I tried to elaborate earlier, if we have certainty that within 1 to 2 incubation periods that we can directly change the direction of the curve and the dynamics of transmission at the ground level, is it more beneficial than having uncertainty for long hours or long days? That is exactly what I'm going to ask you from the last second wave. When we got the first few days of the second wave on October 3rd, and we took almost about 1.5 to 2 weeks even to close the Gampa district. And we saw the impact of it, the epidemic going across the country at the second wave, and for at least 4 or 5 months we took to at least to control it to a manageable level. So this time it's more than that we are seeing from the Minuangoda cluster, where this time within days this has spread across the country, and there are serious indications up to now this would go for extended period unless we take drastic measures to reduce the transmission rates at the ground level. The people who would oppose stating that it will be economic, yes, they have a point. But on the other hand, if we drag this for too long, the health systems would have come to a point, as Professor Malik very clearly mentioned, to a point that we would not be able to cater anymore. So are we going to drag this infection rate till we reach that? That is the first question. And if that happens, all of your economic theories would not work at the end, because when the health system is going to break down and it is going to disintegrate, then whatever the economic gains that you are intending is not going to be achieved. So I think these has to be balanced, and we need to come up with solutions to have 14 days initial lockdown immediately and crush this and make some certainty to the investors and the businessmen, industrialists, and all others to start their business normally at least by mid-June. If you do it now, there is possibility that we can reduce the case incidence by mid-June. If we are still dragging it on, having 3 days, 2 days, having something in between, I don't think we are going in the correct direction. Thank you.
Again, there are more questions coming up regarding concerns regarding the daily wage earners and what would be their concerns. Okay, Dulita, you are there. I mean, you can just express your concerns, because this would be a forum where all the professionals can express their concerns. You can come out with their opinion, your opinion. Dulita Pereira? Because we need to look into the concerns of the different professions.
Thank you, Prof, for giving the opportunity to raise this question. One of the things that, in the business circles, people have been repeatedly speaking about is from the initial lockdowns we have had, all the small and medium enterprises, even the large corporates have had multiple, setbacks, because they had to pay salaries of people. A lot of people have taken pay cuts, and consequently, their businesses have come down. Profits are down. So, and some of the organizations who have been really depending on casual workers, those workers are not coming in because they don't have enough work to be given to those people. Now, that is, on the other hand, is becoming a massive psychosocial issue. On one hand, the entire family is locked down in a house. Your daughter is getting onto an online class in one place, your son is at some other place. If you have multiple children, the problem is even more aggravated. And then there is another set of underprivileged people who doesn't have any of these privileges for them, for their education and various other requirements that they have. So I think when we take a decision, that decision need to be a pragmatic decision where everybody put their heads together. Of course, the guidance would be coming from the medical profession, but I think everybody else need to understand the gravity of the issue, put their heads together, and pull this whole thing together as a nation, as opposed to trying to find solutions in bits and pieces. That is the only comment I just wanted to make. I think the presentation was excellent and very, very informative.
Yeah. Okay, so thank you, Mr. Dulita Pereira, for sharing these concerns. So it becomes a matter of, say, how can we address this current crisis situation, and also what could be the long-term effect, and it's a matter of balancing. Manoj, what do you think? What could be the answer? What are the possible ways that we can think about those underprivileged categories, and what are the ways that they could be supported if there is a decision towards a lockdown?
Actually, some of those has been discussed for last couple of weeks. Actually, one thing that at the first episode or the lockdown, which was very extended lockdown, there was an initiative to establish better supply chains of distributing particularly essential items across, that gave way some of the daily earners some type of a benefit. And actually we could see that it fairly happened in a fairly organized manner for at least 2 to 3 months during April, May last year. However, what we see is there was no enough, I would rather say, support to continue it throughout, knowing that we are going to have the same thing again. So I think from all sides, we did not support this small supply chain starting and doing the business in somewhat a different way. And if that was supported at that time, and if we have established them and recognized them as mobile traders or whoever, giving them very good recognition and screening them for health issues and so on, it could have been one. And we may have to start it from the scratch now. That is one. Second issue, as actually the colleague Pereira was stating, there is a point that he made. At this particular time, there is an issue that the business enterprise and business owners, they find it very difficult to invest in. This is the same thing that I want to tell at the beginning. There is uncertainty. Uncertainty is that there is no clear indication when we can go in normal business. Will it be 14 days, 28 days, or 30 days, or maybe another 3 months? So if we go with this protracted way of handling this, the issue, I think we are creating too much uncertainty in all minds. But if we are going and telling, right, we are going to do this for next 14 days or whatever, and give some hope for them, then they could plan for the future. I think that is a second one. Third one is, I think it's a controversial, this comes to my mind sometimes. Have we really estimated who actually needs government real support? It's a political question. We see every government would try to get large amounts on different pay schemes in the month and in other ways, and try to give them a subsidiary and so on. But is there a realistic way of really identifying who will be actually suffering for 14 days or 21 days of lockdown? And can we only support them rather than make it a political venture, try to get the publicity or support? So do we have that kind of tool to do it? I think that is an important thing that we really need to look at. If not, if you are going to go for all 28 lakhs families, 2.8 million families, and try to feed them, I think then the government will be in trouble and all us will be in trouble.
Thank you, Manoj. So it seemed to be a matter of coordination and prioritizing. And talking about prioritizing, now there are a lot of questions coming related to vaccination also. But due to the interest of time, I don't think we will be able to answer all these questions during this forum. But I request Jude and the other colleagues to answer them in the chat if they can. And just a bit about vaccination during these last 10 minutes or so. I mean, what should be the vaccination program? I would just like to start this discussion going with one comment. We need to move away from the perception that there's a huge fight to get the vaccination now. We need to move away from the perception that if I get the vaccine, I will be safe, towards the perception that if everyone who need to get vaccinated, then everyone will be safe. Manoj, what is your thinking related to vaccination? Even though it may not be the answer for the immediate problem, still it would be an important tool in the long run. So what are you thinking?
I think
what should be the vaccination process for the problem for the country, and what are the challenges we are facing at the moment?
Yeah, actually, this was discussed last year, I think from about August to about December. There was a clear discussion on what could be the vaccination policy, and there is a agreed document called the National vaccine deployment strategic plan, and it has been agreed upon, and it clearly prioritized whom should we give the vaccine. So that is how we started the vaccine program from the health workers, and second priority group was elders over 60. For very clear reason, they will have the highest death rates. So in any society, if influenza, COVID becomes an influenza-like illness with no deaths or no severe disease, it's not going to be a serious issue. But what we find is that when there are a high number of deaths, then there is an issue. If you look at the death rates at the moment, even in the second set of data, about 74% of deaths are above 60 years. So if we go through the agreed vaccine deployment plan, I think that gives the answer, and that will actually relieve the chaos in certain places that we saw through media. I think that it is the answer to this. I am not going into the details of that. And in that priority list, we could think about major economic hubs. For example, major economic hubs where people are working in thousands, these could be vaccinated. And one priority group should be school teachers, where we can start schools slowly if the school teachers, because the children will not get the vaccine anyway. So there are ways and means of strategizing and getting people, the workforce, into work through a proper vaccine strategy. And it has been actually thought about almost about 6 months back, and it's there. The issue is, have we deviated from that or not? My personal perception is, for some extent, we have deviated from the original stance and the vaccine deployment plan.
So again, Manoj, it's a matter of planning and coordination from all the quarters. It's very clear, and from Professor Malik Pieris, it was very clear that we are the crisis. Immediate measures and the urgent measure that need to be taken is immediate lockdown, at least for 14 days duration. So the message is very clear. With that, we come to end of this discussion. I thank all of you for the excellent participation and the contribution, the OPA, the National Issues Committee, as well as the resource persons, including Professor Manoj and Professor Malik Pieris, and everyone who has contributed. With that, we will be concluding this session. However, I think OPA has a huge responsibility here as an apex professional body in the country. We need to press this message very clearly. And OPA should be able to, with all the professions, OPA should be able to provide the solutions related to other issues such as economy, sustainability, so and so forth. I think that should be the very clear message. That should be the priority. With that, we come to the end of this session, and I would like to invite the Secretary General of OPA, Ms. Ruchira Gunasekara, to deliver a vote of thanks. Over to you.
Thank you, Professor Karunathilake. I think you have made my job easy by thanking them, but still I think just as a protocol, I just say good evening, ladies and gentlemen. On behalf of the Organization of Professional Associations of Sri Lanka, so at the outset, we would like to thank our eminent speaker, Professor Malik Pieris, Professor of Virology, National University of Hong Kong, for accepting our invitation and participating at this webinar, despite his very busy schedule and also sacrificing his personal time to be here. And it was a very well presentation. And also we are equally thankful to Professor Manoj Veerasinghe, Professor in Community Medicine, University of Colombo, for sharing his knowledge and insights. We learned a lot from these two eminent speakers in the face of this pandemic situation. So we are, and we are very, we appreciate all their efforts in enlightening us with their knowledge and facts, of course. I'll be failing in my duty if I do not appreciate the efforts of Engineer Arjuna Manamperi, Chairman of the National Issues Committee of the OPA, for organizing this, for initiating this session for not only for the members, for all the participants here. And I must say specifically our Professor Indika Karunatilaka, who is one of the Vice President of OPA, as well as the immediate past President of Sri Lanka Medical Association, for initiating this and for his enthusiasm and for his input, not only as a medical professional, but also as a moderator, for giving his contribution. And I appreciate the support given by the support and all the support given by the OPA secretarial staff in organizing this webinar. But last not least, I want to thank the audience, the members, for their valuable input in making this session is very valuable, so that we learned not only from our eminent speakers, from our audience as well. And also I'd like to thank members of the National Issues Committee and President of the OPA, President-elect, Treasurer at the Office Pieris, members of the EXCO and the Forum, and the past presidents for their advice and guidance in organizing this program. Once again, I want to thank all of you all for your time and effort. Thank you and good night.